But as a child, his father, Governor Mario Cuomo, had a youth engagement program that I grew up with in the Brownsville section of Brooklyn. And that was my first public speaking experience. And certainly to have all these years later and have his son come to my aid and to our city's aid is most gratifying to me. When you want to win, you follow winners. And that is our bottom line. New York State literally went from worst to first. And they have shown the entire country, the entire world, the way to do this right. And so we're excited because Governor Cuomo and his magnificent team of professionals are here in our city. We thank them for their kindness. We thank them for their benevolence and graciousness toward the people here in Savannah. I certainly would be remiss if I did not thank our city manager, Pat Monahan, and members of Team Savannah that have been engaged. We made this happen in little less than a weekend, and yet it happened quickly. And so it's good to do business with people who know what they're doing. So certainly to city manager, I know Chief Mentor is here, to Sergeant Billy Gray and our police details, to our PIO office, to Nick Zola, to Carol, and the city manager's office, Joe Shearhouse, Brett Bell, Heath Lloyd, Taffany Young, and certainly in my office, Marty Johnston and Sharante Turner. I thank them all so much. We're pleased to have with us, I believe, the 64th mayor of our city, Otis Johnson, is here, and members of our wonderful city council. I just want you all to stand so the governor can see you as well. We operate on a team aspect here, so as you said, Governor, we might be the faces, but it's the teams that help make it happen. Yeah. And so we're very appreciative of them. We also, as you have met, members of Savannah's medical community, Memorial, St. Joseph's Candler, Curtis Cooper Primary Health Care, J.C. Lewis Primary Health Care, and then Dr. Russell Petty, who is the Georgia State Medical Association president, and Dr. Bradley, who's just a beast in his own right. And then members of our faith community that you've met, and then Bishop Odom, who is here, is one of the churches that we will be doing testing. And so we appreciate to him, the Temple of Glory and the Kingdom Life Christian Fellowship for helping us out as we move forward. We certainly thank the staff of the Higher Regency Savannah, and we are just appreciative of all of the work that everyone has done, and our local media as well. The importance of today's discussion is to be able to dissect the minds, if you will, to do a post-mortem on people who have done it right, people who have done it successfully, to take their lessons and then be able to apply their lessons practically to what we're doing here in Savannah. We recognize that you are blessed to be a blessing, and you go through a test to have a testimony. And so in this, the governor said quite eloquently that everyone came to New York's aid when New York needed it, and certainly he has been gracious enough not to forget and to be able to offer to his assistance to cities like Savannah that's doing our best to be able to make things happen. Today's discussion was about testing. Today's discussion was about tracing, and it was about training. And more importantly, it's about encouragement to a weary city that has been going through this since the beginning of March. To be able to look and see folks and say, if they can do it, we can do it too. And so I think just your presence here, Governor, to the Team New York, just your presence gives us hope, because we want to be able to talk about COVID-19 in our rearview mirror too. And we want to do all we can to help make that happen. So I am very honored to introduce our friend, certainly my parents' governor, who took time off from his very busy schedule to be here, and will offer his remarks. And I have some gifts. We're the Hostess City of the South, so you can't stop us from being hospitable. That's just kind of what we do. But I am just very honored to introduce the 56th governor of the state of New York, the Empire State, Governor Andrew Cuomo.
Thank you.
I'm glad to have you, Governor.
Thank you very much. Thank you. Thank you. Thank you very much, Mayor. First, it's a pleasure to be back in Savannah. I've been here before. I was the Housing and Urban Development Secretary during the Clinton administration and did a lot of work with Savannah at that time. And a pleasure to be back. So beautiful, so beautiful. The team I brought with me was really taken aback by how beautiful the city is. I mean, it's just striking. You know, you live with it every day, but when you come in from the outside, it's just amazing how exquisite it is. To your mayor, I've been watching him. You know, I watch public officials across the country. I've been impressed with his leadership. I've been impressed with his courage. He's really stepped up to the plate, and I applaud him for it. Let's give him a round of applause, Mayor Johnson. We also have with us here today Henry Munoz from the Somos Community Care Program. He's going to be helping us. He's done tremendous work for us in New York, and he's going to be helping us here set up testing sites. And Dr. Talaj, who is the co-founder of Somos Community Care, and they have been so effective in New York, and they're going to help us in Savannah. I want to thank them. Thank you very much. The COVID poses an extraordinary test to government. In some ways, the toughest test that I have seen in my lifetime. I've been in the federal government, local government, state government. Government has never been called on to perform like this before. Nobody's ever heard of these operations, testing operation, tracing operation, testing the hospital capacity to its maximum. So government performance really matters. And unfortunately, we have more experience in that area than I would like to have had dealing with COVID. We got assaulted by the COVID virus in New York. It came from Europe. Nobody knew. By the way, the European strain is what infected the entire eastern seaboard. I wouldn't be surprised if Georgia wasn't also affected by the European viral strain. Everybody was still watching China, and the virus had moved from China to Europe and then came to the United States. But we had no warning, and we had our first case March 1st. 18 days later, the entire state was closed. The numbers just exploded on us. So we had to learn the hard way, and we did. And the purpose of being here today is first to share what we've done on the testing and the tracing, et cetera, and see how we can help Savannah set that up. It is hard. We made a lot of mistakes. But if we learn from half of the mistakes we made in doing it, we're the wiser for it. So I look forward. We had a great conversation earlier, which was a great start off, I think, but we'll be working with you, Mayor, and I'm committed to following up and setting up testing sites, getting testing into lower income communities, which is a priority, setting up that contact tracing program, which is very, very important. And if you want me to talk to your hospital directors, I'll do that too. I don't know that my jurisdiction extends quite this far, but I think we can come up with some executive order that does. So the governmental capacity, the governmental challenge, we all talk about these operations, but it's one thing to talk about it, it's another thing to set it up. So we will be full partners in helping you do that. But the conversation we had, I think, makes a broader point also. A virus in and of itself is not deadly. It's how the body responds to the virus, right? The human body gets attacked with dozens of viruses on a weekly basis. A healthy body with a healthy immune system can manage the virus, can minimize the damage of the virus. It's the unhealthy body that falls prey to the virus, right? Especially this virus. It preys upon the weak and the vulnerable. It's the weak body that has trouble resolving the virus. The American body is in many ways weak right now. The body politic is weakened. How do you defeat this virus? We all work together in a unified way to defeat the virus, because the virus, by its very nature, defies resolution by any one person. The virus has a community spread component. Community spread. What does that mean? That it spreads across the community. Okay, how do you defeat community spread? The community has to come together to defeat the spread. We all have to come together. We all. It's not enough that New Yorkers come together, because the virus travels. We all have to come together. New York can't do it on its own. It's New York, and it's Savannah, and it's California, and it's Ohio, and it's Maine, because if the virus is thriving anywhere, it will thrive everywhere. So New York, yes, we got the virus under control, and we're now down to one of the lowest infection rates on the globe. Great. I take no peace in that, because if it's increasing in Georgia, and it's increasing in Texas and increasing in Florida, guess what? It will be increasing in New York in just a matter of time. That virus, the way it got on a plane from China and went to Europe, and then got on a plane in Europe and flew to the United States, that virus is going to get on a plane in Texas and fly to New York, or get on a plane in Florida and fly to New York. And New York, in and of itself, can't handle this. And our American body politic is more divided today than it has ever been. We have political differences on COVID. How can you have a political difference on a virus? If there was one thing in life that you couldn't politicize, it would be a virus. Somehow, in this crazy partisan world, we've even politicized a virus. And in many ways, our biggest problem right now is that we are in a state of denial with this virus. I was saying before that we should be arguing about this. All this says is the virus is a problem. The virus is real. The virus can hurt me and can hurt you, and the only way for us to handle it is if we do it together. I wear the mask because I respect you. You wear the mask because you respect me. The mayor was exactly right. This is effective, essential, and easy. And it says we are all in this together, and together we can defeat anything. And I think, Mayor, today, in this conversation, we'll make great progress on setting up all those government operations. But the unity between Savannah and New York, the single mission, the fact that we are interconnected and we are interrelated, and our destiny is linked to your destiny, that is more powerful than anything else. The only way we beat this virus is when we acknowledge that our fragmentation and our division is one of the main problems that we have to resolve. We will get the government operation running. I can help you do that. I know how to do that. We can do the testing, we can do the tracing, we can do all that. But let's not forget, in some ways, the bigger point. We have to realize that none of us is alone, that we are a community at the end of the day, whether we choose to acknowledge it or not. And this nation is always strongest when it is the most unified. That is the strong body and the strong immune system, a unified nation. And a divided nation is a vulnerable nation, vulnerable to religious differences, racial differences, economic differences, geographic differences, and vulnerable to the COVID virus. But that virus is just pointing out that the body was weak, and we have to strengthen the body. And today we did. And it was my honor to be part of it. And Mayor, I thank you and your team for your hospitality. I thank you personally for your leadership. This is a time when public servants have to stand up and lead. These are not easy days. The pressure is on. But when the pressure is on is when you really learn about a person. When the pressure is on, you see what a person is made of. Pressure is on. If there's a little crack in the stone, that stone will explode under pressure. And it's been an honor to watch you under pressure, because you have only gotten stronger, and pressure can truly forge a leader, and it has with you, Mayor. So thank you for the hospitality. Thank you for having us today. This will be the first conversation, and we have a lot of work to do together, but we will do it, and we will be there with you arm in arm. Thank you, Mayor Johnson.
Thank you. I believe, I know the governor's on a tight schedule. I don't know, are we taking any questions?
No questions from the press?
All right.
I like these press conferences, man. You come to New York.
Yeah.
Thank you.
There's a microphone right there.
I'm sorry. Briefly, you do have another little tenuous connection with South Georgia. I've discovered your father played minor league ball not too far down the road from here, about an hour, in 1952, and had a .244 batting average. Wow.
Did you know my father then?
Well, I'm not quite that old. I think I'm about the same age as you. But I do have a question that's not about testing, but how have you been able to balance the economic peril that our businesses find themselves in with the health of the residents and everyone? How do you, they are truly fighting for their survival economically. What has been your experience with that? Any
It's
luck?
a good question. You know, at one point there were different theories put out to the American people, right? Some people said, reopen the economy right away, reopen. And you saw some states reopen right away. New York did not do that. I said, I think if you reopen right away without any data, you're making a mistake, and it will actually come back and hurt the economy rather than help the economy. Those were the two different theories. Open immediately versus open on phases, right? New York, I said, will open on phases governed by the data. And we had 4 phases of reopening, so we staggered it. Other states just opened right away. We now know what has happened. We took those 2 theories into the laboratory and we tested them. The states that reopened right away, you're now seeing them, some of them, close and scale back. Why? Because when you reopened right away without attending to the public health concerns and the virus went up. And when the virus went up, the economy went down. So those rapid reopenings were wishful thinking and wound up hurting the economy. We went through 4 phases of reopening in New York. We're now in our final phase, and our infection rate has stayed down. So if the goal was to reopen the economy quickly, our plan actually did that better than the plans that said just flick the switch and put everything on again. And what people need is to get back to work. And we have to get that economy running. This is an unsustainable position economically. But to get the economy running, you have to do it intelligently. And you're dealing with the virus, you have to follow the substance. because the virus doesn't respond to politics. And that's why following the science was always the right way to go. And that turned out to be the best economic plan also.
Governor, what is your take on Governor Kemp's handling of the COVID outbreak versus Mayor Van Johnson's? And at any point, was Kemp involved in this partnership? Was he invited today? Just a little more background.
The governors, you have different governors across the country, obviously. Each one comes up with their best plan. I did in New York. I will be judged by the history books and by the people of the state, by the results of what happened in New York. And that's how it should be. And then the history books and the people of New York will determine if I did it right or if I did it wrong, or what the overall impact is. And every governor will go through that. And that'll be between that governor and the people of his or her state. In terms of, this was just New York State and Savannah, and it was just between New York and Savannah. And I think the mayor's done an extraordinary job. It's hard to govern now. It's hard. Whatever you say, you annoy people. And it's hard to be in public office when all you're doing is annoying people and you don't have answers to the questions that they want. And you're making difficult decisions that you know are going to put people, make people unhappy. And you watch what people do. I watch what people do. And you see some politicians, some officials, they just don't want to do it. They're not going to take the tough position because they don't want to feel the heat. And some do the exact opposite, and they rise to the occasion. Mayor Johnson rose to the occasion. If I didn't think he did, I wouldn't be here today, because I want to be helpful, but I know that I can only be as helpful as the quality of the city's administration. And I believe it's worth my time and my team's time to partner with Mayor Johnson, because I think he's a professional.
To our end, the state of New York offered, the city of Savannah accepted. And I think that the graciousness of New York State in working with cities has already occurred. Thousands of pieces of PPE were given from New York State to Atlanta, also more recently in Houston. So they are going around the state fulfilling their promise. It is Savannah's turn, and Savannah accepted. Dawn?
Oh, I'm sorry. Since we were not privy to the roundtable discussion, I just wanted to see if the governor would elaborate on exactly what does this mean for Savannah? What does the partnership look like? I know we'll do some testing sites. And also with how you all got COVID under control, were you ever able to get the masses to really embrace the mask?
Good thing you weren't here at the prior meeting. We were talking about you behind your back, just so you know. The New York State was the first state to pass the mask, mandatory mask. Executive order. We did it April 15th. I think it's one of the smartest things that I did. It is proven by the data that masks work. They have these projection models on what's going to happen with COVID. One of the leading models is called the IHME model, which is funded by the Gates Foundation. It's the model that the White House uses. Their model predicts 40,000 more Americans will die because we did not have a national mask policy. That if we had a national mask policy, we could have saved 40,000 lives. How do we ever justify losing 40,000 additional lives because we didn't have a mask policy? We know it works. We know it works. Somehow the mask, when I say this has become a politicized issue, somehow the mask became a political statement. The mask is not a political statement. The mask says, I understand science and medicine, and I listen to doctors and professionals. That's all the mask says, and the mask will save lives. Why would you not wear the mask? I mean, why wouldn't you? 2 years from now, when we look at the numbers and it says 40,000 more people died because they didn't wear a mask, how do you possibly explain that? That is on top of the tens of thousands of lives that will be lost unnecessarily anyway. We are now 5 months into COVID. Why are we still talking about how do we set up testing, how do we set up tracing, how do we do this? It's been 5 months. This conversation started 5 months ago. If the federal government had acknowledged the threat of COVID and said to the states what they should have said, take this seriously, this is a real threat, we'll work with you to set up testing and tracing and come up with a hospital management system. If the federal government had done that, we would not be where we are today. There is no reason to be 5 months into this and still not have set up the basic systems that we knew we needed to set up. You know, what we went through in New York was different. March 1st, we had the first case, we were ambushed. The virus came from Europe, everybody missed it. There'll be questions there too. How did the country miss that the virus left China and went to Europe? What did we think? It was still waiting in China? 2 months later, it was going to wait there for us? Virus is mobile. The virus gets on a plane. But we got ambushed. And we had to set up everything in literally a matter of 2-3 weeks. And we did it imperfectly because it was a matter of 2-3 weeks. We are 5 months later. How do you explain states still don't have a testing operation and a tracing operation? It was 5 months ago we were talking about testing. No, it's government incompetence is what we've seen from the federal government, and it will have cost lives. On top of that is the mask question. 40,000 more lives lost, not out of incompetence, out of arrogance, out of denial. I don't want to say wear a mask because I don't like the political ramifications. 40,000 people die. No excuse. No excuse. Okay.
Hi, Governor. This is from the Savannah Business Journal. Could you share your thinking on how many months ahead you forecast the serious impact to our economy, especially regarding levels of unemployment? And related, do you support rent and mortgage forbearance to continue due to these levels of employment?
Yes and yes on rent and mortgage forbearance for families in distress during the time of the distress. I can't tell you how long the economic ramifications because you can't tell me when the virus will be over, right? Before we talk about how long does it take to recover from the virus, we have to find the date where the virus ends. Now, I believe the virus could have been handled by now had this country done it differently. New York is evidence of that. You can handle the spike. We had the worst spike in the country. We had the worst spike on the globe per capita. And we now have the lowest infection rate. So we know it was possible. We don't have to guess. We did it. I think this has gone on much longer than it should have because of our politics, because of our division, because the federal government is in denial, and because of their incompetence. You also know that's true because other countries around the world have handled it better than we've handled it. How do you explain that other countries have handled COVID better and faster than us? How do you explain that countries that had it first, like in Europe, now have it under control, and they've quarantined Americans from going to those countries because America has a viral infection rate that's higher than theirs. I thought America was the best country on the globe. I thought America was unified. I thought America was smart. I thought America was strong. How are we second to all these other countries? How did that happen? So from a business point of view, if somebody cared about the economy, you know what they would have done? Resolved COVID quickly. That's what they would have done. That was the best thing they could have done for the economy. And now we're still seeing the virus rise when we should have seen it resolved. Every state should be where New York is now. If you could get down that high a spike, all you had to do in the other states was not let the spike happen, right? You didn't start with a high number of cases that you had to get down. You just didn't have to go up.
Could you speak more specifically to what the partnership that you're announcing today is going to entail and what resources New York is going to be providing in addition to expertise just from having already done a lot of this?
We have brought 3 areas. PPE, we have conversations before today. The mayor said that they needed PPE. We brought thousands of pieces of PPE, masks, gowns, face shields, etc. We can get you those numbers. So that is material that we already delivered. The testing and tracing operations are key. And testing that reaches out to lower income communities, which tend to have a higher infection rate, that is key. And getting that done quickly is key. And we have planned on opening 2 testing sites with the city, and those are underway. And they will be models of how to do it, you know, rather than just talking it through. We'll do it together with the city. We'll set up 2 sites, and those can then be prototypes, templates to build from there. On the tracing, we have developed a whole training program for people who are employed as tracers. And we have software programs and database programs that coordinate all their activities, and we'll be sharing that with Savannah and helping them set that up. Okay?
Who's first?
Stand on.
Hi, Governor Catalina here with Community Headlines Live. The question, we're streaming live, and it's the question a lot of our viewers are currently having right now. Savannah is, you know, as Mayor Van said, is the hostess city. New York is also a tourism-based city. To where we know you cannot say an exact time or date, given all the policies and procedures that you've put into place, when do you estimate that New York will open up again as far as tourism goes and Broadway and all those things? And what are your projections and our mayor of Savannah's projections for tourism to open up again as it at least somewhat was here?
Yeah. The New York, our infection rate is very low. So the question isn't about the infection rate in New York. The question is about the infection rate in the rest of the country. That's the question to us. When does the rest of the country get the infection rate down? It's increasing in about 40 states. When do we get it under control in those other states? Because our problem is we don't want to see our infection rate go up from people coming from out of state. So it's not really in New York's control. It's really beyond New York. But as soon as we get the infection rate under control across the country, New York is ready.
As it relates to Savannah, tourism for us really never stopped. If you look on our streets, folks are here. They're here enjoying the great weather, our wonderful streets, our history, of course the food, but the goal for us is to be able to do it in a safe way. We have folks that come here, they drive again. I spoke earlier about being on the I-95 corridor right off of I-16. We are a river city, we have a beach city, we're a military city. We have a lot of things going on for us. And the goal really is we have to slow the numbers down. Right now, we're running behind COVID-19. So For us, although we are managing it, I think we have a good relationship with our tourism partners. We want to continue that, and we're going to need their help, their continued help. And we know, again, masks are the way to go. So we know that we can create a certain level of safeguarding by encouraging, by mandating that people are wearing masks that are visiting our city. Because again, as the governor said, when they come to us, we don't know where they're coming from. And many of them come from other places where they were restricted. And so they come to Savannah to live their best lives. Well, for Savannah, that's not good for our citizens, for our employees, and for the folks that we love. So for us, we want to manage tourism. And again, I think that we've done a relatively good job. I think we just have to keep our foot on the gas as it relates to wearing masks and making sure we're vigilant about social distancing and making sure, again, that we are remaining concerned about people and not necessarily about the profit.
Mayor, with your permission, let me just follow up on a question before to give a specific answer. In terms of materials, we brought down 124,000 masks, 7,500 test kits, 7,500 gowns, 7,500 N95 masks, 7,500 face shields, 1,200 gallons of hand sanitizer, and we're setting up 2 testing sites at the Temple of Glory and the Kingdom Life Christian Fellowship Church. And we're doing that with Somos Community Care, who we've partnered with in New York, and Dr. Talaj and Henry Munoz are here today, and they'll be helping us set them up here.
I just want to add, I said earlier that love is an action word. You can tell folks you love them all day long. And so we're looking at New York loves Savannah. Well, the governor and his team and the gracious folks of New York State have shown love by sharing what they have with us. They could have certainly easily kept what they had in storage, held it for a second or third wave, but they were kind enough, again, to not only offer it, but also to bring it down, and that PPE is in our city at this moment. It came, well, some of it came yesterday, and some of it came with the governor. So again, we're just so appreciative of showing and practicing what you preach.
Thank you very much, Mayor. I love that expression. Love is an action word. I think I'm going to steal it. I'll credit you with it the first time, but then I'm just going to steal it.
Sure. Go ahead.
Thank you, Governor, for being here today. John Dowding from WSAV. Question for the both of you. Something we've seen Governor Kemp here tweet and say in press conferences the last couple of weeks is how hard it is to enforce a mask mandate. So the question I have is, how does mandating a mask mandate as compared to encouraging a mask mandate, how does that make a difference, and how do you go about enforcing a mask mandate?
It's a law. You enforce it the way you enforce a law. A lot of laws are hard to enforce. You're not allowed to smoke here. That's hard to enforce. Not allowed to have an open container of alcohol. That's hard to enforce. You know, a lot of laws are hard to enforce. I'll tell you, I don't think the mask ordinance is all that hard. You know who winds up enforcing it? Other people. You don't need the police to enforce it. Now, New Yorkers can be a difficult group. I can say that. So we put it into place again, the first state to put it in place. And the greatest enforcement comes from other people. If you are in their presence and you're not wearing a mask, you better be fleet of foot. You know, people don't want you jeopardizing their health. And our mask compliance, I'll bet you, is in the high 90s. And most of the enforcement is from other people. Our greatest challenge on the masks are younger people, 20 to 35, basically in situations where they're at a party or they're drinking. But people understand it. People get it.
Well, thank you. We're going to go ahead. I know, again, the governor has a very tight schedule. We really wanted them to stay overnight and enjoy Savannah. We were trying to disable the JetBlue plane so they could stay here a little while longer. But Governor, again, we appreciate, again, your kindness, your friendship, and certainly for looking out for Savannah. we will be eternally grateful. And so we have a great artist here in our city who is also a social activist of sorts. And so he wanted to make sure that we presented this to you. His name is Panhandle Slim. And it says, a governor can be a very good friend to people. A governor can be a formidable force. And so I want to present this to you.
Beautiful. Thank you so much. Thank you. Thank you.
And of course, because we show hospitality, as you know, the mayor has the ability to issue a key. And I want to thank you. Open any doors in our city that you would like to. Again, thank you so much.
Thank you very much.
Thank you.
Thank you.
And we'll
Thank you. You know, New Yorkers are not as well known for their hospitality. But we had this box made for you, made by the state. This is a seal of the state of New York. It's the seal of the city of Savannah, Mayor Van R. Johnson. And this is for you as an expression of our unity and our solidarity and what we can do together. So thank you very much.
Thank you so
very
much. Beautiful.
Okay, thank you all so much. And it's the beginning of a productive relationship. Thank you very much.
Thank you.
Thank you for sending the email already.